What do the names mean? With HEMEpath cancers/neoplasms, that is, leukemias and lymphomas, we try to track all of them back to their otherwise normal counterparts. This is a big part of the logic behind the naming systems. The naming system also gives us the ability to tailor treatments toward particular proteins that a specific line or family of cells will express that other lines of cells won't express. The goal is to treat the leukemia or lymphoma and leave the other body cells intact and unharmed. What is the difference between leukemia and lymphoma? Leukemia is a hematopoietic neoplasm that occurs in and lives mostly in the peripheral blood or bone marrow. Leukemia can be myeloid or lymphoid. Lymphoma is a hematopoietic neoplasm that occurs in and lives mostly in the lymph nodes or in some sort of mass, such as retroperitoneal, pelvic, mediastinum, etc. Lymphomas will only be lymphoid. There are many different types of leukemias and lymphomas. Currently, there are two major classification systems: the World Health Organization classification, which is on its 5th edition, or WHO-5, and the International Consensus Classification, or ICC. However, there are similar names and characteristics for the vast majority of diseases. In both systems, there are a lot of different subdivisions of leukemia and lymphoma. For example, the acute myeloid leukemias have more than 20 different types. There are more than 20 large B-cell lymphomas. There are more than 30 lymphomas with small to moderate cell morphology. However, these become more manageable when we break them down into smaller categories and groupings. Acute leukemias. Leukemias can be acute or chronic in nature. In general, acute leukemias need to be treated today or this week. Chronic leukemias may be treated next week or later. Leukemias may be myeloid or lymphoid in differentiation. Acute myeloid leukemia is a blood cancer that arises as too many myeloid blasts, or myeloblasts, are present without appropriate maturation. As mentioned before, there are many different types, and they are classified primarily based on examination of the chromosomes and specific gene mutations. In the absence of advanced studies, morphology may be used to classify acute myeloid leukemias. There are also some based on the history of other diseases or inherited genetic disorders. The acute myeloid leukemias frequently have acute myeloid leukemia in their official name, followed by the subtype. However, there are some exceptions. There are 38 flavors of acute myeloid leukemia. See note. Note: the counts throughout this chapter are my own and not official statements from either the WHO or ICC. The numbers may not exactly correlate with the table of contents because I may include diagnoses from other chapters that I believe still fit the broad category. If a different organization scheme or count makes more sense to you, please use your own count. The purpose is to have an organized accounting of all the diagnoses. End of note. Acute lymphoblastic leukemia, ALL, is also a disease of too many blasts, but the blasts show lymphoid differentiation, or lymphoblasts. They show a protein profile of either early B cells or early T cells. There are several acute lymphoblastic leukemias that present in the blood or bone marrow. These are also subdivided primarily based on examination of the chromosomes and the discovery of characteristic breaks and rearrangements. The acute lymphoblastic leukemias also have lymphoblastic leukemia/lymphoma in their official name, with B or T preceding it and are followed by the subtype. There are 13 B-ALL and 2 T-ALL. Similar cells presenting as a mass will be called acute lymphoblastic lymphoma. As mentioned before, leukemias can be acute or chronic in nature. The chronic leukemias can also be myeloid or lymphoid. However, the naming of both the myeloid and lymphoid sides is more complicated than their acute counterparts. First, the myeloid side. Chronic myeloid leukemia is a specific disease with the unique diagnostic feature of the Philadelphia chromosome, a rearrangement between chromosomes 9 and 22. There are several other myeloid leukemias with chronic nature and have other names depending on a number of other variables. Oftentimes, these are called neoplasms to distinguish them from acute myeloid leukemia. These other diseases may be grouped into myelodysplastic syndromes, myeloproliferative neoplasms, and myelodysplastic/myeloproliferative neoplasms. We're concerned about the chronic leukemias on the myeloid side because they can turn into acute myeloid leukemias if left untreated. We want to treat them and deal with them before they get to that point. Myelodysplastic syndromes are called myelodysplastic neoplasms in the WHO-5 classification. However, in both classifications, they are abbreviated MDS. When these entities were first described decades ago, they were actually syndromes. That is, a set of connected signs and symptoms without a known cause. But now we know what they are, and so calling them a quote-unquote syndrome is really a misnomer. They have an abnormal phenotype, or lack of appropriate maturation. They have clonality, various mutations or rearrangements. They do bad things by causing cytopenias, neutropenia and or anemia and or thrombocytopenia. It's just that the term MDS has been used so long that it's hard to change the name. MDS are characterized by cytopenia and dysplasia. Dysplasia is abnormal maturation that shows abnormal cell morphology. The abnormalities are altered nuclei and cytoplasm in the granulocytes, nucleated red blood cells, and or megakaryocytes. MDS are subcategorized by cytogenetic/molecular features or by morphologic features as a last resort. There are 8 MDS categories. Myeloproliferative neoplasms, MPN, typically show too much maturation. They are characterized by cytoses, leukocytosis, erythrocytosis, and or thrombocytosis, but without significant dysplasia or morphologic abnormalities. The leukocytosis is typically of neutrophils or eosinophils. They all have clonality, which is characterized by particular gene mutations rather than chromosome rearrangements. There are 7 to 8 MPNs, depending on the classification system. Myelodysplastic/myeloproliferative neoplasms, MDS/MPN, are characterized by a combination of cytopenia and cytosis in different lineages. The cytosis can also be of monocytes. For example, there may be anemia and thrombocytosis, or there may be anemia and monocytosis. MDS/MPN is not a blanket diagnosis, for if you are unsure of whether there is an MDS or MPN. The slash does not mean either or. In this category, the slash means both. Each MDS/MPN is a specific diagnostic entity. There are 4 or 7 MDS/MPNs, depending on the classification scheme, with more categories in the ICC system. We've now covered the myeloid side of chronic leukemias. On the lymphoid side, there are chronic leukemias as well. Chronic lymphocytic leukemia, CLL, is one specific type of lymphoid leukemia with chronic nature. There are many other lymphoid leukemias with chronic nature and have other names depending on many variables. The first branch point is to navigate whether the abnormal lymphocytes are B cells, T cells, or NK cells. There are 9 of these lymphoid leukemias. However, when finding malignant lymphoid cells in the peripheral blood or bone marrow, it is important to rule out a lymphoma, or tissue-based lesion. Sometimes a few lymphoma cells may escape to the peripheral blood. Furthermore, a few or many lymphoma cells may invade the bone marrow. Lymphomas. Lymphomas are exclusively lymphoid. There are no myeloid lymphomas. Lymphomas present as masses or efface, that is, replace, the normal lymph node architecture. They may be divided primarily into B-cell lymphomas and T-cell lymphomas, and a few types of NK cell lymphoma are recognized. B-cell lymphomas are initially separated based on the size of the abnormal cells, either large or small. Classic Hodgkin lymphoma, which is a B-cell lymphoma, also has large abnormal B cells. There are 25 B-cell lymphomas with large size and 14 with small to moderate size. T-cell lymphomas are initially separated based on the surface expression, while cell size is not so important. There are 22 T-cell lymphomas. NK cells are identified based on surface expression and EBV infection status. There are 3 NK cell lymphomas in adults. There are also 4 EBV-associated T/NK lymphoproliferative disorders in children that are beyond the scope of this introduction. The ICC classification numbers of lymphomas are fairly similar, plus or minus about 2 to 3. Acute lymphoblastic lymphomas, which present as masses, are not included in the above counts, since they were counted separately as acute diseases. Pre-malignant B-cell conditions are also not included in the above counts, since they are not considered a fully grown lymphoma. Plasma cell neoplasms occur later in the lymphoid B-cell maturation pathway. These include plasmacytoma, plasma cell myeloma, or multiple myeloma, and plasma cell neoplasms with associated paraneoplastic syndromes. Multiple myeloma is a particular type of plasma cell cancer or neoplasm. There are 9 different types of plasma cell neoplasms, depending on where the plasma cells are, if there are clinical signs or not, and whether a monoclonal or M protein is present. For starters, just mix and match those 3 features. There can be a small amount of plasma cells and no signs, or perhaps lots of plasma cells and many signs. There can be a ton of plasma cells with an M protein and no symptoms, or perhaps overwhelming plasma cells and no M protein. The clinical signs can include classic CRAB findings, such as hypercalcemia or anemia, or be a more complex paraneoplastic picture, such as skin changes or neuropathy. Each of these combinations points in a different diagnostic direction. A couple extra notes. 1. There are also several non-myeloma disorders of clonal immunoglobulins, heavy and or light chains, that are associated with clinical signs and symptoms but are not necessarily considered a fully grown lymphoma or myeloma. Some may even be secondary to or mimic other named lymphomas. 2. Since plasma cells are the later product of B cells, sometimes B-cell lymphomas can have some cells that look like plasma cells but are actually part of the B-cell lymphoma. In summary, leukemias, acute and chronic, and lymphomas. This is the overarching structure, and nearly everything in HEMEpath can fit into this framework. So if you know the chapter cover chart, then you can work your way through the different neoplastic processes and find a general category to put them in. Next, navigate to a specific diagnosis as your knowledge base grows. Most of the time, the cases cooperate with you and will fit in a box. Only rarely they don't cooperate, and you'll resort to giving a long explanation for why a case doesn't fit well with any previously described diagnostic box.